Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Can you explain the recent World Health Organization warning on processed meats?
The World Health Organization put together a group of experts from around the world, and they looked at all the studies, particularly very well-designed studies on processed meats and red meat and association with all cancers, but specifically colorectal cancer. And they found that consumption of processed meats, or about 50 grams per day, is associated with an increased risk of colorectal cancer. Red meat consumption was also found to have an association, although not as strong a link.
The World Health Organization places processed meats in the same category as tobacco. Are they just as dangerous?
I think that statement maybe is still a little strong for the person who maybe just eats a hot dog at a ballpark when they take their kids to a game. But if you're eating processed meats on a daily basis, over 50 grams, and in association with that, you probably have significant risk factors that put you at a higher risk category for colorectal cancer, then yes. But I think to go that far, I don't think we're there yet. It's one of those things where it's moderation is key, and exposure on a very small quantities throughout the year is probably not going to be that influential.
What was your reaction to the WHO's warning on processed meats?
There is, and I think many of us have believed that there is a link because of some of the compounds that that are used for curing and processing that have been associated with creating certain chemicals that are associated with developing or causing mutations and progression of disease. So there is, I think it reinforced those beliefs, but again, you know, if it's my patient that I'm talking to and they ask these same questions, I would tell them that if you consume it in a moderate fashion, you should be okay. But if you're doing large quantities on a daily basis, then maybe you should change your practice.
What are some examples of processed meats looked at in this study?
Some of the processed meats that they looked at or are included are things like bacon, salami, bologna, all those anything that's cured or processed in that fashion has an association, or in this study or in their review of all the studies that were done showed a strong association with colorectal cancer and some other cancers as well, but more specifically colorectal cancer.
Should those at higher risk for colorectal cancer be more concerned about this warning?
If they are someone who has these risk factors, and in addition to that are consuming large quantities of red meats and more specifically processed red meats or processed meats in general, like bacon and hot dog and hamburgers and things of that nature, and the salamis, then and they're doing it on a daily basis or consuming over 50 grams or 1.5 ounces per day on a daily basis, then yes, they should be more concerned, and they should probably either change their eating patterns or be surveyed and seek attention sooner.
What does moderation look like when consuming processed meats?
If you're consuming processed meats once a week or once every other week, you should be fine. Maybe even a little bit more than that, you should be okay. But if it's on a daily basis, then that's probably a little too much.
Should processed meats be cut out of your child's school lunch?
Parents can look at what's included in the lunches. They usually have a listing of how much grams of processed meats there is, or how much gram of turkey or gram of salami is included. And if it's over 50 grams and it's on a daily basis, perhaps you may want to change those patterns and start it early. I think the downside with cutting all meats out is that you lose out on some of the important nutrients and proteins that you really need. So I think to go to the extreme step of saying cutting it completely out, then you're going to be causing nutritional deficiencies down the line.